It's really more of taking care of yourself, loving yourself, so that you'll be able to take care of others as well.
Sa mga young people, no, it's really important to understand our body.
We need to start looking at sex from a place of care, love, and respect.
Sexual health is a vital part of one's personal wellness. Now, taking care of your sexual health can have a significant impact in your quality of life. Here in the Philippines, where sexual health issues is very prevalent, it is important that we have the right knowledge to not only protect ourselves, but our loved ones as well. I'm Dr. Freddy Gomez, and welcome to Med Talk Health Talk. Joining us today is Love Yourself Director for Programs and Innovations, Danvic Rosadino. Youth and Sexual and Reproductive Health and Rights Officer from Women's Global Network for Reproductive Rights, we have Danica Magtubo. And we have Sex and Relationship Therapist, Dr. Rica Cruz. Now, let's start off by talking about the landscape, the overall situation of sexual health here in the Philippines. Danica, can you give us an idea?
Recently, the Commission on Population have mentioned na mayroong downward trend pagdating sa adolescent pregnancies in the Philippines. But when you also look at sino yung mga nagiging partner ng mga very young adolescents na nabubuntis from the ages of 10 to 19 years old, particularly sa 10 to 14, no, sila ay actually mga kabataan na merong sexual relationship with older men.
Let's talk about the importance of sexual health. Danvic, can you give us an idea?
According to the Maslow's hierarchy of needs, sex is an essential need. But because we are a conservative culture here in the Philippines where we view sex as taboo or kabastusan, we really don't talk about it. That's why all topics that are, attached to sex, it's not mostly discussed here in the country. And that includes sexual health.
When it comes to the sexual issues that are most prevalent here in the Philippines, what are some of the examples that you can give us, Dr. Rica?
Sexual health issues could be like domestic issues, relationship issues, and also, sex trafficking, porn. There's a lot of issues that we really need to talk about when it comes to our sexual health, but we don't get to talk about it kasi nga, parang it's so taboo.
Danica, in your perspective, where do you think the Philippines is compared to the rest of the world when it comes to sexual health issues?
Yung mga adolescents na nabubuntis ng maaga, they still do not have access to basic sexual and reproductive health services. Even our law says that the Reproductive Health Act does not allow minors in the Philippines to have access to contraception. So, compared to many countries, even those who are also developing, napakarami nating hahabulin kasi nga in terms of legal, political, and also yung mga social, even nga yung, as mentioned earlier, hindi na pag-uusapan kasi nga tabu ang topics.
Now, Danvic, when it comes to not just teenage pregnancy, but other sexual issues, do you think communication is a key role here? Not just being able to communicate, but kapag nag-communicate man sila, tama ba yung information na nako-communicate nila?
Yeah, definitely. It's very, very important. We are facing these problems today because we don't talk it at our houses. Teachers are not comfortable to teach about sex education. So their tendency is to search for other sources of information. And sometimes their sources of information are not that factual, they're not that accurate, and sometimes they just tend to explore. I remember in the data that's presented by Department of Health, people are engaging into sex as young as 12 years old. And imagine where they could get that information.
Now, that's a very important issue in terms of communication, Danvic. That's why I'd like to ask Dr. Rica naman, when it comes to communicating, saan ba dapat nakukuha ang information, ang knowledge when it comes to sexual health? Magulang ba? Kaibigan ba? guro, sa teacher? Where should that communication come from?
Kasi alam mo ba kung saan tayo natututo about sex? At the moment na isang malaking sexual health issue rin ng ating bansa. Alam mo kung saan?
Saan, Doc?
Sa pornografiya or pornography. Because we didn't have any other source of information then, right? That's what we have. Ngayon, di ba, parang isa tayo sa may pinaka mataas na rate na nanonood ng pornography sa buong mundo. And then, what happens there, kaya siya mali, dahil iniisip natin na kung ano yung napapanood natin, yun yung tama. When it's really not true, because pornography is made to entertain and to arouse people. At dahil may misinformation na doon, parang na-perpetuate yung kamalian ng impormasyon tungkol sa sex. Saan ba dapat nagsisimula ang impormasyon tungkol sa sex? Sabi ni Danica kanina, kailangan sa magulang, which is true. Kailangan talaga sa magulang. Ang problema, hindi equipped ang mga magulang ngayon to talk to their children about sex kasi hindi sila komportable dahil wala rin naman silang modelo when it comes to that. So they cannot start, diba?
That's right.
And then after the mga magulang, papasok na yung schools. Pero hindi rin equipped ang ating mga eskwelahan at mga teachers to talk about sex.
When we come back, we shift our discussion to HIV and AIDS. So keep it right here on Med Talk, Health Talk. Welcome back to Med Talk Health Talk. In today's episode, we're talking about sexual health issues here in the Philippines. Now, we are still with Love Yourself Director for Programs and Innovations, Danvic Rosadino, Youth and Sexual Health Advocate, Danica Magtubo, and Sex and Relationship Therapist, Dr. Rica Cruz. Now, let's shift the discussion to HIV and AIDS because I think a lot of Filipinos, for that matter, are still, I wouldn't say in the dark, but ill-informed when it comes to the difference of HIV and AIDS. Please enlighten us, Danvic.
So basically, HIV stands for Human Immunodeficiency Virus. It is the virus that when it enters your body, it causes immunodeficiency or unti-unti nga sinisira ang iyong immune system. And when there comes a time na sobrang sira na ng iyong immune system, it leads to AIDS or the acquired immune deficiency syndrome. Basically, if it's cancer, it's the stage 4 or the late stage of HIV infection.
Lahat ba ng taong nagkaroon ng HIV ay may AIDS?
Not necessarily, because we know for a fact na they may be late diagnosis, so they may have AIDS. But most of the people, they are in early diagnosis. So ibig sabihin, they still not in the AIDS stage, and we can prevent that through treatment.
Do we have any statistics now on how young or what is the demographic of those who are infected with HIV and AIDS so we can target that and hopefully slow it down at least?
Yeah. Right now, we have around 100,000 Filipinos that are diagnosed with HIV. And it's getting increasing because we are diagnosing 41 Filipinos per day that they have HIV. And the fastest growing age range, actually, in terms of the people getting HIV are actually the youth. It's 15 to 24 years old. And that's the fastest growing in terms of age range here in the Philippines.
Danica, when it comes to that, pasok doon ang youth when it comes to that realm. Sila ang more or less nagda-drive ng increase. What can you say about that?
Yung patuloy na pag-increase ng HIV cases among young people, specifically 15 to 24 years old, this is also an implication of not having sexuality educations, yung comprehensive sexuality education na dapat binibigay ng reproductive health law at na kailangan natin i-revisit at talagang hingin sa ating government.
I think yung sinasabi ni Danica kanina, na isa sa mga barriers ay yung access to free contraceptives ng ating kabataan na ang mga minor, kailangan pa nila magpaalam sa mga magulang nila to be able to access these contraceptives. So, kung kunyari hindi sila makakuha ng condom pero gusto nilang mag-sex, they would still have sex, unprotected sex, which is very risky. Kaya tumataas yung yung rates ng HIV or sexually transmitted infections dun sa age range na yon. So kailangan talaga bigyan natin sila ng tamang access to contraception.
That's an important point, Doc Rica. No? How important is the cultural framework of a certain place, a country like the Philippines, when it comes to the challenges of trying to give that access to
Napahinga ako.
to things that can prevent HIV and AIDS?
It's very important. You can see it happening here now. Diba? Yun. Unwanted pregnancies, teenage pregnancies, rise of sexually transmitted infections. And it's because our country is so conservative that we feel that we shouldn't be talking about sex, and that when we start to talk about sex, it will encourage people to have sex, when studies say it's the other way around. That when you teach our children, the youth, comprehensive sexuality education, if we talk about sex openly without the stigma or that taboo saying porn versus pornography, diba? It's basically the same thing. But if you can accept it as it is, the children will have more agency to be responsible when it comes to their sexual health.
How important is testing and the access to testing?
We cannot stop, the culture overnight. So what we can do is at least to be aware of the services that are available. Aware that, there are many combination prevention options for you to prevent HIV. And if you access treatment, you cannot transmit HIV to other people sexually. But the importance, to access those services is testing. You need to test yourself so that you know how should we take care of you. If you're HIV negative, you have many combination prevention options so that you prevent the spread of HIV. You prevent, getting HIV. And if you are HIV positive, you can access treatment so that you could live a long, happy, and healthy life. So there are many facilities that are available that offers free testing. There are government facilities, Us Love Yourself, and other organizations are providing free testing. They just need, to go to the right people. And if you have an HIV test in itself, right information will also be provided. So it's not only for you, but of course, to tell other people, to not only to stop the spread of HIV, but really to stress the importance of, taking care of your sexual health.
Two individuals, brand new relationship, they want to go into a monogamous relationship, but they say, wait, before we get into this, HIV testing muna tayo.
Before you have sex with anyone, you have to ask for the sexual history. O gusto nyo sabay kayo mag-test para, intimate. At least magiging mas close kayo. But you really have to be responsible for your sexual health and the sexual health of your partner by saying, okay, I'm tested and we're negative, but I still want to be protected, so I will use different kinds of contraceptives. Ganon, kailangan pinag-uusapan siya. Kailangan hindi tayo nahihiya sa isa't isa about it.
Now up next, we'll discuss more about sexuality here on MedTalk Health Talk. Welcome back to MedTalk Health Talk. Now we've been talking about curbing and understanding sexual health with our guests, Love Yourself Director for Programs and Innovations, Danvic Rosadino, Sexual Health Advocate, Danica Magtubo, and Sex and Relationship Therapist, Dr. Rica Cruz. Now, Danvic, in our day and age, how significant is culture when it comes to sexual health?
It influences sexual health. It doesn't only, limits us to get the right information, especially in a conservative culture, but it also limits us to access the services. Many people, if we talk about it to our friends, you might be branded as, ay, bakit malandi ka? bakit you are, engaging in sex? Or, it limits us going to hospitals or, clinics that are providing sexual health services, even though we create our services that are, stigma-free and,
Right.
really judgment-free. It limits them to go there.
Now, Doc Rica, still in the topic of culture and how it affects sexual health, how does gender roles become a factor in proper sexual health, especially here in the Philippines?
May isang malaking factor yon ng gender roles dito sa Pilipinas. Lalo na ako sa yung mga kalalakihan at kababayan in like a heterosexual relationship, because women are seen as like the submissive, passive, sexual person, to the extent that the men naman are seen na kailangan alam mo to. Diba? Kailangan ikaw ang magtuturo dun sa mga babae. Tapos yung mga babae naman, they're expected to be chaste and pure and not to know anything about sex, to the extent that they're not supposed to talk about sex and they're not supposed to advocate for their own sexual health, sexual rights, and even sexual pleasure.
So, Dr. Rica, what then is the ideal relationship with good sexual health?
Good sexual health in a relationship, ibig sabihin, merong aspect of respect sa inyong dalawa na gusto nyong maging pleasurable yung sexual life nyo as partners, at hindi nyo dinidisrespect yung isa't isa. So you're really advocating for the enjoyment of one another. Good sex is really the barometer for a good relationship. And there are studies that say that the top 2 reasons why marriages dissolve are money and sex. So you would really want to have good sex in your relationship because that translates to good communication, intimacy, good connection, respect for one another.
What kind of information or what kind of tips can you give the youth now in order for them to be able to, change the current situation maybe in the future?
Siguro sa mga young people, it's really important to understand our body. Though malaking role pa rin talaga kasi nun kung ano yung natatanggap nila na information, they will not understand the functions of their body or even have bodily autonomy if they do not have the access to correct information. So, hindi lang responsibility ng mga kabataan yung pag-i-improve ng situation ng sexual health or sexual and reproductive health sa Pilipinas. Responsibilidad yun ng community natin, and that also includes the government.
And then Vic, if you were to encapsulate our topic for today, what kind of advice would you give our viewers?
Sexual health alongside with other aspects of health is really, really important because it can affect relationships. It can affect how we see other people. I think it's really important to, to assess your overall health and wellness, and that includes sexual health. So it's really more of taking care of yourself, loving yourself, so that you'll be able to take care of others as well, sharing that concept of self-care to other people, so that, we will have a world where we are all healthy, regardless of health aspect.
And of course, Dr. Rica, what kind of advice, what kind of tips can you give someone who has heard the topics that we've talked about here and wants to know more about how to have a good relationship with good sexual health?
We need to start looking at sex not from a place of fear, not from a place of shame or disgust. We need to start looking at sex from a place of care, love, and respect. That sex is actually good, hindi siya bastos. Tayo lang yung ginagawa lang natin siyang bastos, kaya napoperpetuate natin yung kabastusan nito. But if we change that narrative and actually say that, sex is such a good gift for us, and it's enjoyable, it's pleasurable, we can teach it properly to our children, we can have it and enjoy it with our partners, and then we can protect one another because we're all responsible having good sex. It will really do good to our community if we just start looking at sex as how good it is really.
With that, thank you so much, Dan Vic. Thank you so much, Danica, and of course, Doc Rica, for sharing your insights and giving the viewers a different perspective with regards to sexual health. And that's the ultimate goal for this. I'm Dr. Freddy Gomez, and thank you for joining us here on MedTalk Health Talk. We'll see you again next time.